Dear friends, ladies and gentlemen, please allow me to conclude the chapter on hypertension, seeing this section on the treatment modalities. We are going to see the preventive measures and the treatment that can be applied to mitigate this problem. If you see, if you've seen the previous sections on the causes, eh, on the introduction, definition, the causes, and risk factors, and seeing the complications, sign and symptoms, then we are going to be able to understand this last section, which is on the treatment. How do we approach it? How do we try the best possible to fight this high blood pressure? And eventually, how can we win it? So please let me share with you the slides, few slides. We are not going to take too long. And this slide will help us to see the way we can really approach this hypertension and try to fight it. We have seen the problem it causes. We have seen that it can be a serious problem. Remember, we confirm hypertension by checking with the BP machine. Eventually, you need to check it at 3 times on different occasions. 3 times different occasions. Then you will see so that is it high or not high. So let's answer this question now, how to treat it and how to prevent it. Let's go. Remember that the main issue is on the vessels. That's where the most complications will take place. We remember how we started explaining the pump, the vessels, the blood inside. Now, let's see what happens. 1, if you take too much salt, as we said earlier, it means we are attracting more water in the vessels. So we are increasing the volume which will increase the pressure. So the treatment is what? To reduce the salt. That's a treatment number 1. It's very interesting that we can treat by being careful in our lifestyle. Eating less salt, not adding salt to your food every time, not eating these zimbas that we keep on eating every moment, these food that are packed with a lot of salt, minimizing them, being disciplined will help a lot in fighting the hypertension. Food, trust me, wherever you do your researches, wherever resources that you will use, you will find that plant-based diet has a positive impact in building blood vessels. It has a lot of vitamins, minerals, proteins, especially which are dedicated to go to build the vessels. Do you know what you call action potential or electricity of the body? It uses minerals that we find in the plant. What about the heart and the potassium that we know it will come from fruits? What about vitamins that would go and build, especially like these carrots? We know what the carrot does on the eye. We are advised to eat different types of food, especially which are colorful. This advice is for you and it's for me. Plant-based diet is advocated. We've been hearing what they call a health diet. Why do they call it healthy? So why don't we go for healthy if it is healthy? So this is one way of fighting diabetes indirectly, but very effective. You can see if they are advising us to go for fruits, if you go to fat, we go to the plant-based fat, which has less toxic effect, and we go to the nuts which have a lot of good oil inside as well. We get your grains, your fruits, your beans, veggies. These are the ones that we need most. So we need to emphasize on what is good, and we need to encourage each other. Interestingly, Very interesting for people who believe in writings of the Bible. When you read in Genesis chapter 1, verse 29, God gave food to humankind. And please go and read what is there. He said, this shall be your food. It will be food for you to consume. That what was the prescription from the Almighty God. So I believe God said it for a good reason, because in the plants there is a lot of medicinal properties that can heal our bodies. Before we go to treatment, we should apply exercises. Exercises is not only for young people, it's not for the teenagers. Exercises is for everyone. If you are 70, if you are 80 years, you don't have excuses. We need to do exercises, all of us, all. This lady is more than 100 years, she's still doing. So you who are 60, who is 70, what excuses will you give if more than 100 are still doing exercises? Why? Exercises will help on the vessels to dilate. They dilate, they become flexible so that the pressure can be smaller in the blood vessels. Exercises has a lot of benefit, but we are not going to talk about exercises. We'll have a topic itself on exercises. The impact the exercises will have on the brain, on the stress, on the thinking, on the heart, on the muscles, on the joint. We'll have a separate presentation for that. But today, we are fighting hypertension by doing exercises in helping blood vessels to dilate and making the heart strong so that it can push blood without failing. Sugar. We saw that sugar, once you take too much sugar, the body will take the smallest amount that it is in need of. Anything more than what it needs, the body will transform it into fat. Then it will go and pack on the body, and other fat will be packed in the vessels, as we saw. You saw people who like too much chocolate, who like too much cakes and bread. You eat it over and over, then you know what you are building up. You are building up something. And if you take more energy than what you are using, for sure, obesity will come, and will come with the negative effect. Same way as fat is being consumed, the fat will go and block the vessels, as we said, as it will be interfering also on the expansion, the dilatation of vessels. The bad fat, mainly from the meat, red meat, please go and read about it. It is written. Scientists have written about them. They even say that some of the red meat, with other factors in combination together, not only high blood pressure, but also it can expose to some cancers. Let's face the truth. Let's face it and talk about it, and advise each other in a proper way. Alcohol, we know cardiomyopathy, alcohol related. Alcohol can be toxic to the heart, to the vessels. Cigarette smoking, or it is even written on the cigarette that the cigarette can be a poison. So you take it at your own risk. So the more you take it, the longer you take it, the more the damage will be. So if now it happens that you reach the point of starting your medication, you have started with your lifestyle modification, you know the foundation is very good, you have done your best, you have done your exercises, you are eating healthy, you are avoiding things that are problematic, but still your blood pressure is high, then it means you need medication. Or you have checked with the doctor says, no, it's high time that you start medication. If you start your medication, please take your medication as it is prescribed. That is what we call adherence to treatment. Adherence means you are really faithful to your treatment. You don't take it when you remember, you take it regularly. In addition to that, you have your BP machine. I encourage you, if you have high blood pressure, buy your own machine. Check your BP, write it down. Write day in the morning, write at night. So end of the day, after 1 week or 1 month, you have been recording. Even when you go to the clinic, or you go to the hospital, you will show this is how my reading. For sure, the most important part here, you will be able to know what is normal with you without waiting for the surprises. So, two, the doctor, whoever will be treating you, will be able to see, this thing is working very well. You see, the BP is getting control. If it's not, it will help to readjust. So that's how it is. So if they are trying to readjust, they give you medication depending at which degree your hypertension is. One, if it's a step one, they might just give you one type of drug, just one. They might give you like this one we call angiotensin converting enzyme inhibitor, like enalapril. You know, if they see now there is a problem, they can put a second one, calcium channel blocker, amlodipine. They can add it if you see one is no longer enough. They have exhausted the highest dose of this medication. Or if there is a need to put a third one, they will put it, especially diuretics, which help to decrease the volume. You know, if it is very bad, they can give you 4 drugs. So always there is indication for everything. You just don't do it randomly anyhow. There are steps that need to be followed. So before we finish our topic, which I believe was interesting, I wanted to ask, I'm giving you a test. If you followed nicely, can you check among these and tell me which one is not normal? The upper systolic is these ones on top. The lower ones are these one low. So one is 120/70. You need to tell me, is it normal or abnormal? 180/110. We are doing the test now. You should answer. Maybe you should write on your paper. Then we are going to see the answer afterwards. Then third one, 160/90. Is it normal or abnormal? You need to answer yes or no. 200/130. Is it normal or abnormal? Because this is proving that you followed the presentations. What about 100/70? How is it? And 75/40? Which one is normal? Which one is abnormal? 110/68. I need your answer. Is it abnormal or it's normal? 139/80, 170/100, and 240/140. Which one is normal? Which one is abnormal? Let's see the answer. Then you give yourself the mark. These are the answers. Anything that is in green is normal. Anything that is in red is abnormal. We saw that anything that is around 80, 200, 240, it's a disaster. We are in problems. And here we saw that it is in the red, I mean in the yellow. You're about to jump and fall into hypertension. This one, it's not in the category of hypertension, it is hypo. We just put it showing that it can be abnormal, but our topic today was on hypertension, high. We did not talk about the low one. So just leave this one aside. Consider the other ones which are higher than the normal, but the green ones, these are preferred one. If you have this, you have this, you have this, you are very good. Please, let's aim at beating high blood pressure by monitoring, by eating healthy, by following guidelines, by taking medication if they are prescribed as it is supposed to be. Then apply what we call New Start. New Start, please put in on Google if you want. You will find what we call New Start, which is nutrition, which is a proper one, which is healthy, exercises, drinking water, enough water that the body needs, sunshine that helps the vitamins to be converted, especially vitamin D, to be temperate, temperance in everything that we do. When you exaggerate in everything you do, it becomes a problem. We need a fresh air where oxygen should be coming in our houses. We need oxygen. We need it to rest. You don't remain restless in everything you do. Rest is very important so that you can be more productive. Then, above all, you trust God. We can't depend on ourselves. If we did not create ourselves, we cannot depend on ourselves. So God is able to help us to overcome. That's why this new start is very important. If you apply it, we'll overcome. Thank you very much for following the presentation. I'm very pleased that I'm convinced actually that you enjoyed the presentations, and I believe they will make a difference. My request is, if you know somebody with high blood pressure, please, on a condition, if you found this presentation useful, please share. If they are useful, if they are useless, leave it. It's okay. But if they are useful, share. Give to anyone that you know has high blood pressure. Share with anyone that you know has a family member with high blood pressure. That will be your contribution. That will be enough for you. Now, if you are a medical professional, you are a nurse, you are a doctor, you are a dietitian, can you please come on board and put your contribution? There is something that you can do. We should not rely on tablets, on medication always. Yes, they are important, we know, but why can't we work first on the education? Why can't we combine education and health and see the difference to be made? I know we may not find the feedback in a very short time, but with time, somebody will give a testimony. Say, you know what? This information changed my life. I have that hope. Please, let's come on board. Let's do it. Let's transform our families. Let's help them. Let's build our communities. Let's build our countries. And let's transform our Africa. Let's start on Africa. Maybe we can grow bigger and transform the world. Why not? Thank you so much for following the presentations, and may God bless you. Thank you so much.